Hi, everybody. How are you going? Lovely to be back here and see you. So what I want to do today is teach you what to do when a client comes to your private practice and they've got a GP mental health care plan. And this is going to be a super simple process that you are going to love because it's going to actually help you build connections with doctors that can refer to your private practice, because you and I both know they're not necessarily referring to us for, services and this, that, and the other. A lot of the time it's coming back to, at the very foundation of things, it's the relationship. Okay, so we really, really, really want to build that relationship with any and all referrers. So here's a scenario. Client comes along, they have a GP mental health care plan with a referral letter. And the referral letter, for example, let's just say it's made out to a psychologist. It says, "Dear psychologist, thank you for seeing, Jane Doe, John Citizen, for depression and anxiety under a GP mental health care plan, from Dr. John Smith." Now, the client says to you, "I can't get in to see a psychologist. The wait list is too long and I need help sooner. Do you have, can I see you?" So here's what you do. You say, well, yes and no. We need to check with the doctor first. And the reason we need to do that is because your doctor sent you for one service and I offer a different service. They're kind of the same, but they're still kind of different. And just want to make sure that you're getting everything that you need. So if it's okay with you, let me call your doctor and I'll explain to the doctor that you can't get in to see your preferred psychologist, and I will see if I can work something out with them. Okay, client says yes. You get the client to sign an authority to, for you to speak with their doctor. You call the doctor and you say, "Hi, Dr. Smith, my name is Brooklyn, and I have this lovely lady here, a patient of yours by the name of Jane Doe. She has a referral to see a psychologist, but she can't get in and she's wanting to see somebody quite quickly. Now, I'm not a psychologist. I can't see her on the mental health care plan that you've given her, but I am a counsellor and I can see on the referral that you're wanting her to have some support with depression and anxiety. That actually happens to be two areas that I specialise in. I've done a lot of training. I've been working in this field of depression and anxiety for many, many years, and I'm confident that I can help her. We just wanted to check in with you about the referral. Are you happy for me to support your client, or would you prefer that she go and see a psychologist? What would you like to happen here?" And the doctor's going to say one of two things. He's going to say, or she or they will say yes or no, right? So if a doctor says, "Do you know what, that would be amazing because she really does need help soon and she can't actually be on a waiting list for a long time. I'm happy for you to go and see her. Please just keep me updated about how she's going in therapy with you." You say, "Amazing. I will definitely keep you posted. I'll give you a progress update after we've had a few sessions together. Sound good?" The doctor's going to say, "Yep, sounds amazing. Thank you so much. Great. You're all done." Now you can say to the client, "Yep, we've got the green light from your doctor. Let's go ahead and get you booked in." You can book that session off your trot. If the doctor says no, they would really prefer that this person gets the service that they've referred them to. That's fine. It's nothing personal. That's fine. What you're going to do is you're going to say, "Okay, no problem. Would you like a couple of, I know two psychologists in our area that actually work with these types of issues. Would you like their numbers?" Now, what you're doing here is, without sort of being intentional and consciously realizing it, you've just become a resource for that doctor, right? You haven't said anything negative, untoward. You've been a resource because now you're saying, "I know people, and guess what? They might have capacity a bit sooner, or I know that they're really good," or something like that. Would you like the numbers? You create your reputation then as being a resource for that doctor. Now, you're also going to say to the doctor, "Yeah, here are the two numbers of psychs in our area or social workers in our area," or whatever it is that they're wanting the referral to. And then you're going to say, is there anything else that I can help you with at the moment? And doctor's probably going to say no. But they might also say, yeah, tell me a little bit more about you. Why haven't I heard of you before? How long have you been in the area? You know, what else do you do? Do you work with anybody else? And so what's happening here is you're starting that conversation. You're starting that connection. The doctor's starting to get to know you. And this is an opportunity for you to also say, well, do you know what? I am busy here at my practice, but I'm happy to prioritize clients that are referred through you, Dr. Smith. You know, now that we know each other, I'm happy to give your clients priority or something like that. You know, you don't have to say that, but you want to nurture the relationship. And that's one way that you can do that. So that's kind of the process. And I think that is going to feel really good for you. It's going to feel really great for your client because there's been full transparency. The client doesn't need to go, you haven't sent them back to their doctor and the doctor's now doing all this stuff. No, so there's no inconvenience for the doctor or the client. There's no inconvenience for you. Everybody's been transparent with each other. So it's an even playing field. We're all on the same page and there's been honesty, authenticity, integrity, and all of those sorts of good things. Okay. So now some people will say, oh, you don't need to ring the doctor. Now, I feel like you do need to ring the doctor because we're talking about somebody's health and the doctor knows more about this patient or client than you and I do. And yes, the client can absolutely go and see whoever they want. But I think if somebody's got a diagnosed mental health condition and the doctor's referred them to a specific service, we do need to touch base with the referrer, let them know, oh, there's been a little bit of a detour here. This is us. This is who we are. This is how we can help. And just kind of take it from there. Okay. And yes, if the doctor says that they're happy for them to see you, amazing. The client's always got the choice of seeing you or holding out for a psychologist. So there you have it. Super simple process that's above board, ethical, transparent, in integrity, that's going to be useful, helpful, and effective for all parties. So do you love it? I do. This works. I've shared this process with other people in our group right here, and it works for them as well. And they're now receiving referrals from doctors that used to send referrals to psychologists. So how cool is that? So I'm sharing it with you too, because I want you all to be able to create thriving and successful private practices without the ickiness and without the yuckiness. So I hope this was really, really helpful. Let me know what you think, and I'll see you in the next video next week. Bye.